Okay, the question is what are ophthalmic products? So the answer should be it's like defining what is an ophthalmic product. It's not about asking you the examples, right? So if you get a question, okay, list five ophthalmic products, then the answer is correct. So for this question, what are ophthalmic products mean? It's like you are defining what is an ophthalmic product, okay? Any other answers?
Ophthalmic products are products used for diseases, diagnostic purposes, and surgical purposes of eyes. They should be sterile, non-irritating, and safe, and contain preservatives.
Okay, that is okay. That answer is okay. So you can add like they are sterile, liquid, semi-solid or solid preparation intended into the eyelids or the conjunctival sac, right? And they are used for the therapeutic diagnostic purposes, right? Okay, the second question I asked you all to not write. So it's about formulation scientists plan to produce an ophthalmic drug of a drug, explain the factors. So it's about, okay, so if it's a ophthalmic drug means, okay, it contain a API and excipient. So as an ophthalmics, as a scientist, what they have to consider as a formulation, okay, what is the API they are going to select, right? So whether the API is, first thing they have to select is whether the API is soluble in water or not. Because if it's soluble in water, they can go for a solution product. If it's not soluble, they can increases the solubility or they can use some non-aqueous vehicle. So first thing they have to see the particle size, the solubility of this product, right? And then they can select what is the vehicle. So depending on the solubility, they can select whether the water, glycerol, right? So usually you all know these ophthalmic drops are sterile products. So mostly it should be using a water for injection or a sterile water for injection. If it's prepared in a aseptic technique or if it's in a terminal sterilization, yes, then you all can go for a final stage sterilization, right? And definitely because they are multi-dose preparation, you need a antimicrobial preservative and you need a viscosity enhancers, right? Improve the viscosity so your eye drop will retain more time inside the conjunctival sac. And you can add antioxidant in order to prevent the deterioration of your API, and you can add wetting agent in order to reduce the surface tension and to improve the drug compatibility, right? And adjuvants like tonicity adjusting agents, right? Again, the antioxidants are repeated. Buffering agents to maintain the buffer, and yeah, viscosity enhancers again repeated. So these can be added. So why you add a buffer is to maintain the pH between 6 to 8, right? And definitely the package, because these are multi-dose preparations and they are usually coming with a dropper in order to apply. So the eye drop should be packed in neutral glass containers or any other suitable containers, and with a screw cap fitted with a dropping device, right? So the third question discuss the
What
benefits.
you said, what you said about terminal something you told?
Yes, there are. Do you all remember the sterilization process? So one is aseptic preparation. So it is throughout the procedures. You are maintaining a sterile environment and you will be preparing. So final stage sterilization means once you prepare the product, at last you autoclave or you make a suitable method in order to sterilize the entire product. So while the manufacturing is happening, there is no need to maintain a sterile environment. But
Okay.
the environment should be clean. But the final stage sterilization means after you prepare the product and package and everything, overall the product with packaging will be sterilized, right? Aseptic mean you maintain a sterile environment, and inside that environment you fill it, close it and pack it, and then send it to the warehouse.
Okay.
Third question, discuss benefits of using ocular insert for the drug delivery. Ocular insert?
May I read the answer, Miss?
Yeah, sure. Anyone can read.
Provides a steady and prolonged release of the drug, and it minimizes the drug loss due to tear drainage, blocking and nasolacrimal drainage. It also delivers the medication directly into the site of action and reducing the systemic side effects.
Okay, good. So the benefits of ocular insert, mainly ocular inserts are sterile solid products which are inserted inside your conjunctiva. So they have a drug reservoir in the center and they will be continuously delivering the medicine to the eye. So they are usually administered for a prolonged use, right? And the drug from the central reservoir is giving a medicine in a precise and predetermined rate, and it shows a controlled release. There is no sudden fluctuations, peaks or valleys in the drug concentration, and the sterile preparation that prolongs the resident time, right? So these are the main benefits adding to that less directed by the nasolacriminal drainage, right? So fourth question I asked to not do, right? Explain the advantages of using a nasal dosage form. So again, nasal dosage form means any nasal drop or nasal spray. So if you administer those things, what happens is the medication will be directly delivered to the site of action. And the scientists have recently identified if like insulin, right? It's a peptide hormone. So insulin cannot be taken as an oral product because it may get digested by the pepsin enzyme. So they have found out that insulin can be added, given to the body as a nasal spray. And for the migraine or Alzheimer's or any other brain-related diseases, the medication can be directly delivered as a nasal in the nasal route, so it can be going to the brain, right? So and also it's bypasses the first pass metabolism, and it bypasses the gastrointestinal degradation, right? And it's a rapid absorption method, just like a uh, inhaler, right? And quick onset of action. So these are the benefits, right? So one more benefit is if you deliver some medicine through a parenteral route, that's an invasive method. So there will be a sharp needle or something will be pricking your skin and inserting, but this is a non-invasive and non-painless method, right? So the fifth question also I asked to not do. It's also the same type question, just like the second one. The consideration like particle size of the nasal spray has to be optimized. API have poor solubility to overcome co-solvency method or suitable non-aqueous vehicle can be selected. And delivering the API from nasal spray has to be regulated, and each press should ensure same amount of drug delivered into the nasal cavity. And drug administered should not be removed by the nasal cilia, and adherence to the nasal mucosa should be achieved. And again, antimicrobial preservative should be added, right? And viscosity enhancers and antioxidants, osmotic agents, or tonicity adjusting agents should be added, right? So only thing is, you don't always need a sterile preparation for a nasal spray. Sometimes it can be sterile, sometimes it can be non-sterile. So it is not a compulsory one, ophthalmic one. And ear drops, so ear preparation, definitely they haven't to be any way a sterile one, right? Okay, the fifth question, what is a large volume parenteral? So the basic definition of a large volume parenteral is any sterile preparation that contains volume above 100 milliliter to 1000 milliliter is usually known as a large volume parenteral. But technically, up to 100 milliliter, we consider it as a small volume parenteral. But if it's come like 101 to 1000 milliliter, we consider it as a large volume parenteral. So if a vial or ampule which contains only 100 milliliter, you have to classify it into a small volume parenteral, not a large, right? Okay, compare large volume and small volume parenteral. Can one of you all read your answer?
Large volume parenteral is more than 100 milliliters and small volume parenteral is 100 milliliter or less than 100 milliliters. Large volume parenteral is used for hydration, electrolytes, nutrition or drug infusion, but small volume parenteral are used for injectable drugs, vaccinations or additives to large volume parenterals.
Yes, so okay. So volume wise, so small volume parenterals 100 or less than that, large volume 101 to 1000. So usually route of administration, small volume parenterals, IV, IM, subcutaneous. So large volume parenterals, we can only give them as a IV route or non-IV route means sometime before the surgery for the cleaning or dialysis purposes, we use these. Maybe a large volume parenteral is, yes, of course, 101 to 1000 milliliter, but there are irrigation solution or some cleaning dialysis solution where they will be coming in a 5 liter or a 2 to 3 liter can. Again, they have a sterility, but actually they are not for a IV purposes. They are for the cleaning, cleansing, irrigation purposes. So they are considered as a non-IV preparations. So dosage unit, always small volume parenterals are for single dosage or sometimes multiple also available like multi-dose vials. But large volume parenterals always they are for a single one-use preparation. So that is the reason why they are always single-use preparation. They don't need a preservative, right? And for a small volume parenteral, if it's a multiple one, we use a preservative. If it's a single one, again, no reader. So large volume parenterals, buffers is required. Buffers is not required for a large volume parenteral, right? Because it's always what we give is a kind of a normal saline dextrose solution. So they are always in a neutral pH. But small volume parenteral, yes, it's used. And formulation, yeah, they both can be prepared in all solution emulsion way. So isotonicity, because it's a small volume and less than 100, even if you give a hypertonic or hypotonic, so that is not going to influence your overall tonicity. But the large volume parenterals, because they are 1 liter sometime, if you didn't maintain the tonicity, they can cause damages to your cell. So always large volume parenteral should be isotonic. And again, pyrogenicity, these are large volume, definitely they should have a pyrogenicity. So make sure there is no antigens or foreign bodies are there. And use small volume is basically for the therapeutic purposes and diagnostic. Large volume parenteral is usually for a fluid supply and fluid balance, detoxification, surgery for those purposes, right? So the eighth question, why antimicrobial agents are not added to a large volume parenteral? Yes, I have already discussed the answer. So they are single-use preparations, therefore not used. Right? So in a multi-dose containers or vials, you will be using antimicrobial. Okay, state 5 routes of parenteral dosage for administers. Anyone can read your answer.
Intravenous, subcutaneous, intradermal, intramuscular, intraosseous, intrathecal, intracardiac.
Okay, so this is a very simple question, right? And question number 10, write a short note on the following. Yeah, can some of you read your answer?
Preparation of sterile solutions for intravenous administration involve combining two or more medications or substances. Process for it's administered who cannot take orally or need for rapid onset of action. Multiple drugs administered in a single infusion.
Okay, so IV admixture is basically you have IV fluids, right? So IV admixture is you are combining actually two or any more sterile products, basically the IV fluids, and you will be mixing in a aseptic condition, and you are going to prepare a admixture. So they must be sterile and free from pyrogens, right? They are administered into the body. So aseptic technique is used, right? Because IV admixtures are not pre-prepared. Like IV fluids, they come as a manufactured product, like normal saline or dextrose solution and all. But IV admixture is basically prepared under a pharmacist guidance, right? Basically, it's under a doctor's prescription. A pharmacist will be preparing it in a aseptic environment, right? So usually IV admixtures are a combination of two or more IV fluids mixed together in an aseptic environment in order to achieve some desired therapeutic or a fluid balances. So sometimes it's used as a combination therapy, like normal saline, dextrose, sometimes vitamins, some medicines are added together, right? Total parental nutrition. One of you can read your answer. Yes, what is total parental nutrition?
Uh, Total parental nutrition is a method of feeding that bypasses the gastrointestinal tract. It is used when a person cannot eat or absorb nutrition through the digestive system.
Okay, so total parental nutrition is a personalized therapy or pharmacological therapy where the nutritions like minerals, macronutrients, micronutrients, minerals, vitamins, electrolytes, and medications are delivered via a venous route to the patients whose GI tract is not functioning and are unable to tolerate, right? So any person who put on a ventilator or any person who is having a sometimes colorectal surgery where their colon part or a large intestine is being removed, or gastrectomy where a part of a stomach is removed, so therefore they can't absorb some of the nutritions, right? So these type of patients will need a kind of a parental nutrition which can sufficiently provide them all the minerals, vitamins, electrolytes they are required. So uses of a total parental nutrition is to maintain and improve their nutritional status, and to maintain and correct acid balance and electrolyte disturbances, and to improve cardiac and respiratory function by restoring the glycogen storage of the cardiac, and diaphragmatic muscles, and to minimize the deleterious effects of catabolism by maximizing the protein synthesis, limiting the protein breakdown, and reducing the weight loss, and to accelerate the rehabilitation and improve the quality of life. That is the basic advantages of and about the uses of these total parental nutritions. Right? Okay.
What are ocular inserts? That question.
So I have already discussed.
Yeah,
Yes. But it's all, I checked it's in your presentation, right?
yeah.
Yes, you all want me to explain again.
Briefly, not benefits. What is exactly a total exactly a ocular insert? It's a it can be semi-solid or solid.
So it's mainly most of the time the outer layer, this adhesive layer, the drug reservoir or the end part, right, which the external part. Okay, external part, okay, this is the adhesive layer or the external part. They will be usually in a solid consistency, but the center drug reservoir, it's usually can be in a solid consistency or a semi-solid consistency. Usually this will be packed, and through that the adhesive layer, kind of a selective absorption of the medication will take place.
Okay.
So once you insert them inside the conjunctival like sac like this, it can be delivering the medication for a prolonged time. So contact lens is also a similar type of a thing, but it won't be inserted by forming a pocket or something. It will be inserted directly into the pupil. So that's the difference
Yeah.
between a contact lens, and contact lens doesn't contain any medication. This contain a medications, right? So those are the differences between contact lens and ocular insert. Basically, they both uses the same theory. It's like you will be inserting them inside the eye and it will be stayed there for a prolonged time. Okay. So now we'll go back to the chapter 4, regulation and control of all aspects pertaining to medical devices. So, part one is about medical devices regulatory division. So, just like a medicines regulatory division, we have a medical devices regulatory division, right? So, just like a MDRD also, medical devices regulated division also contain some persons holding recognized degrees in medicine pharmacology, because medical devices also, some medical devices are used for the medicine and pharmacy purposes, right? So medical devices regulatory division function is, so they will coordinate and regulate, control everything related to medical devices, right? So other function coordinating the application submitted for the registrations or the renewal or registration of the or getting the license or cancellation, renewal, suspension of the medical devices or registration for the importers, distributors, and coordinating with license, yeah, I already mentioned, and provisions of administrative assistance to the Medical Devices Evaluation Committee. So just like Medicine Evaluation Committee, MEC, there is a committee called Medical Devices Evaluation Committee for the purpose of reviewing the medical devices. So part 2, Medical Devices Evaluation Committee. So for the purpose, there is, so therefore, for there is a purpose, right? So the medical devices evaluation committee. So it shall be appointed and it can be known as MDEC. And the principal function of MDEC is to carry out technical evaluation of the medical devices, right? So whether the medical devices is working based on a software or to evaluate the software, right? So whether it is previously used in any other countries or how much cheaper it's to be used in the Sri Lanka. So those type of principal function of these medical devices, right, carry out the technical evaluation, right? And it will be considering everything forwarded for the registration and submit a report to the authority. So the report shall specify the benefits, risk attached to the medical devices and the efficacy, quality, safety, need and cost as well, right? And pharmacoeconomic analysis were necessary in keeping the national medicine policy. So it consists following members, MDEZ. So again, the head of the Medical Devices Regulatory Division is function as the chairman, and the Deputy Director General of Laboratory Services, because remember this is a device, right? And the dental services, because there are dental devices. Biomedical engineering, right? Anything that uses, for example, if you are using any blood testing stripes or these kids, right? That's used for the COVID test or any other dengue test or whatever the kids, right? Used for the analysis purposes is usually coming under this biomedical engineering techniques. So anyone from there, and head of the NMQAL, right? And nominated members, just like same to the medicine, senior professor or senior lecturer in pharmacology, professor or a senior lecturer in pharmacy, and professor or senior lecturer in biomedical engineering. It's an additional thing to the, not in the medicine. And director of Sri Lanka Standard Institute, SLSI, and Director General of Atomic Energy Board, right? And consultant of transfusion medicine, general surgeon, microbiologist, biochemist, right? If you check the medicine, these people are not. An anesthesiologist, oral maxillofacial surgery, right? Dental surgeons, physician, radiologist, right? Because anything related to the radiopharmaceuticals, right? And a pharmacist in charge of the medical devices. So the quorum contains 7 members and nominated members time period is 3 years, right? So the authority can appoint a panel of experts, right, specialized in medical devices. So they can appoint these additional members to the Medical Devices Evaluation Committee from the panel of experts depending on the subject matter dealt with the MDEC. And members appointed shall be present at the meeting for which their presence is required and express their opinion, but they don't have the voting rights. So every member of MDR division and MDEC shall, entering upon the duty, sign a declaration that they will be maintaining the secrecy, the meetings, everything, the information will not go out, right? Connected with every matter connected with MDRD is kept under seal. So the MDEC, which has come to his knowledge in the performance or exercise of his powers and functions under this act, and shall by such declaration pledge himself not to disclose any such matter. So usually MDEC people also should keep the secrecy unless it is required by the court in order to give information or for the purpose of exercising or performing the functions under this act. So the general guideline is given by the authority to the Medical Devices Evaluation Committee for the evaluation of the medical devices. So the general guidelines is based on the good manufacturing practices and other recommendation and guidelines. So the guidelines can be revised from time to time, and the MDEC shall take into consideration the efficacy, safety, quality, and need of each medical device or related item in the process of evaluation and consider pharmacoeconomic evaluation. So minister usually make regulation on the procedures followed to be followed or specify time limits, right? And give effect to the good manufacturing practices and the provisions of section 5.2. If you remember, these will be again applied to here as well, right? So the third part is about offenses pertaining to the medical devices, right? So the authority shall list from time to time the medical devices registered under the Act. So if you visit the Nmra website and go to the medical devices, there you can find a tab called Registered Medical Devices in Sri Lanka. If you download it, it will give you the registered medical devices in Sri Lanka, right? All the list of medical devices registered, whether it's a glucometer or an inhaler, metered dose, or a dry powder inhaler, or whether it is a recommended test kit, anything, right? So that will be registered here, will be presented in the Excel sheet, right? You can download the Excel sheet and have a look. So no person shall import, sell, transport, distribute, or advertise a medical device other than the medical device given in this section, right? And no person shall manufacture, prepare, store, preserve, package, or repack any medical device without adhering to the GMP. And no person shall import, distribute any medical device without adhering to the good distribution practices as well. And no person shall sell medical devices without adhering to the good pharmacy practices. So GMP, GDP, GPP, all three should be practiced. So no person shall manufacture, import, assemble, transport, sell, or distribute any medical device that may cause injury to the health of the user when the medical device is used. And under the condition that are customary or usual in the use of the medical devices, or according to the directions on the label accompanying the medical devices. So about the labeling, packaging. So no person shall label, package, treat, process, sell, assemble, distribute, or advertise any medical device in a manner that is false, misleading, deceptive, or likely to create an erroneous impression regarding its safe and efficacy, right? And standards. So where a standard is already being given for a medical device, no person can label, package, sell, distribute, or advertise any medical device which does not conform to such standard, right? For example, if there is a glucometer which is more suitable to check the blood sugar level, but the accuracy, maybe if these are machines, so the machines have a sensitivity, accuracy. So it's have a medium to moderate sensitivity and accuracy, but you can't claim like it's always correct. Like or a pressure checking meter, there can be some machinery faults, right? But giving some false information and giving about it's 100% accurate, it has 100% sensitivity, like that you can't give some false information where the standard is already being given, or a standard even if there is no standard, you can't claim a fake standards. So advertising importation, and no person shall advertise, promote any medical device without prior written approval of the authority. And no person shall advertise or promote any medical device to the general public as a treatment, prevention, cure for any prescribed diseases, disorders, abnormal physical states. So no person shall, without prior written approval of authority, import, sell, distribute any medical device to the general public as a treatment, prevention, cure, or for any prescribed diseases, disorders, or abnormal physical states. And no person shall, other than the persons permitted by the regulation, have in their possession any medical devices may be restricted or prohibited by the regulation. So any person who contravenes any of the provisions specified in part of this act commits an offense, right? So it's the same procedure for the registration and licensing, right? The part 4, the last part for the medical devices. So no person shall manufacture or import any medical devices without registering the medical device with the authority and obtaining a license from the authority. And no person shall store, assemble, repack, distribute, transport, sell medical device without obtaining a license for that purpose from the authority. And any person who contravenes any of the provisions specified in subsection 1 or 2 commits an offense, right? So applying for the registration, it's same as for the medicine. So anyone who intends to manufacture or import, make an application for the registration of medical devices in the prescribed form where you can download it from the Nmra website. And the application shall be accompanied by the prescribed particulars, clinical trial data, samples of the medical devices. Maybe because this is a medical device, the manual, maybe sometimes the customer manual or the guidance how to use the medical devices, right? With the prescribed fees. And the authority shall maintain a register in which every application received for the registration and licensing of a medical device shall be recorded. And the particulars to be entered in such register shall be prescribed. So authority shall, after receiving the application, submit a copy of the application together with the samples to the medical device, right, available to the Medical Devices Evaluation Committee to evaluate the application and medical device, considering the need to ensure the availability of efficacy, safety, and good quality medical device relevant to the healthcare need of the public in the affordable price. So this is the main duty of MDEZ, to check the 5 things, right? And then a sample will be given to the NMQAL where it will be tested for the quality of the product. So the authority shall inform the applicant in writing the receipt, right? And the minister can make regulations setting out procedures to be followed by the MDEC and NMQAL regarding the respective testing and the evaluation process. So specifying the time limits for conducting the test. So these regulations can be made by the minister. And the manners in which MDEC conduct the meeting and procedures, and the matters which should be included in the reports to be submitted, right? So the authority may require the MDEC and the NMQAL to finalize the evaluation or testing within a specified time period, considering the urgency of the medical device. And MDEC and NMQL shall, within the time limit specified, submit their reports to the authority unless there are compelling reasons for any delay. So registration, the authority may, where necessary, call for the clarification from MDEC and NMQAL or any other expert with regard to the report submitted by the MDEC and the NMQAL. Authority may, upon taking into consideration the report submitted by the MDEC and NMQAL and all other relevant factors, register such medical device or refuse the registration within the stipulated time period. So where the authority registers the medical device, so the registration shall be informed to the applicant in writing and may inform the public the registration by publishing them in the Gazette. And where the authority refuses the registration, The refusal shall be informed to the applicant with reasons and the stipulated time period, and shall inform the public such refusal by publishing them also in the Gazette, right? So the provisions of section 62, 63, 64, 65 of this act will mutatis mutandis. So if you check the 62, 63, 64 and 65, I think these are the same rules that applied for the medicines in the chapter 4, right? So they are same thing and they will be applied to medical devices as well. That is what mentioned by this section 86. So it's for the issuing of certificate, which mean the minimum time period is 1 year and maximum is 5 years. And once you get the registration, once the registration is about to cancel, about to expire, you should again renew it before 6 months before the expiry. And issuing of license and renewal, registration or license, and cancellation or suspension of the registrations or the license, right? This all part is applicable and same for the medicine, medical devices, and the borderline products, right? Yes, that is for the medical devices. Regulatory, right? Chapter 4. So just take a 10-minute, 5 to 10 minutes break, right? And we'll finish this chapter 5, right? So after that, there is only 2 chapters remaining.